Welcome to the HART EHS video series where we discuss all things health and safety. I'm Alan Tran, and I'll be kicking off the series with this episode on silica exposure. We see in the video a skilled worker dedicated to his craft. Little does he know, a hidden threat is at play: silica dust. Respirable silica dust is created during tasks like cutting or grinding concrete, and is more than just a nuisance. It's a silent danger that can lead to irreversible health issues. Silica is a common mineral found in the Earth's crust. Materials like sand, stone, concrete, and mortar contain crystalline silica. These materials are made into products such as glass, pottery, ceramics, bricks, and artificial stone. When workers breathe in crystalline silica particles, ones that are at least 100 times smaller than the sand you might find on beaches and playgrounds, a cascade of events unfolds within their lungs. These tiny particles, once inhaled, penetrate deep into their lungs, and silica's abrasive nature triggers a chronic inflammatory response. Over time, may lead to a condition known as silicosis. Deposited silica particles can cause the formation of nodules and scars. This leads to the stiffening of the lungs, compromising their ability to expand and contract. As the disease progresses, the scarring makes it increasingly difficult for the affected person to breathe. Imagine your workers struggling for every breath. Silicosis makes it a grim reality. Silicosis doesn't just affect the lungs, it affects lives. The very lives of those who contribute to our industry's growth. Silicosis is not the only health effect to be concerned about. Chronic obstructive pulmonary disease, lung cancer, and kidney disease are other health effects which affect Canadians who are occupationally exposed to respirable crystalline silica. As young professionals in the environmental health and safety field, we've seen firsthand the impact of silica exposure. We're here to spread awareness and enact change. As an employer, the responsibility falls on you to ensure a safe work environment. Let's explore key steps to control silica exposure. We begin with a risk assessment and determining whether there is an issue. Occupational hygienists can work with you to help you recognize, anticipate, evaluate, prevent, and control exposures to silica dust while your workers are conducting work on the job. Whether sampling was performed or a silica control tool was used, the hierarchy of controls can be applied to lower workplace silica dust levels to below the allowable legislated exposure limit of 0.1 milligrams per cubic meter for the quartz or tripolate form of silica, or 0.05 milligrams per cubic meter for the cristobalite form. If that is something that interests you, I'll put a link in the description for you to explore later on your own. There is a silica control tool that has been provided by the occupational health clinics for Ontario workers. It is a tool where you are able to put in different parameters, and it would be able to tell you by pulling from different data points whether your workers would be overexposed or not. It also recommends some controls, and this type of tool is geared or best suited for companies where the work might be temporary or because of budget constraints, and therefore sampling might not make too much sense. Engineering controls means implementing measures like ventilation systems and water suppression to keep silica dust at bay. A little investment in control goes a long way in safeguarding your workforce. Training is also crucial. Make sure your team is well versed in the correct usage of equipment and follows safety protocols to the letter. Personal protective equipment. Ensure that your workers have the right gear, including respiratory protection, to shield them from harmful silica dust. Equipment is selected and fitted to each worker after a thorough evaluation of the workplace and its activities. Health monitoring. Regular health checkups for your workers can catch potential issues early on. Detecting problems sooner means providing timely medical intervention. By implementing these measures, you're not just meeting regulations, you're saving lives. Our commitment to safety defines us. Let's build not just structures, but a legacy of responsibility and care. Together, we ensure a future where every worker goes home safe and healthy.